Hello and welcome to this presentation for Transition to Residency regarding a poster presentation on more preparation to care for first trimester bleeding and cramping in your office or emergency department, clinical vignettes and counseling. The objective of this transition to residency session was created to improve care of patients who present with first trimester bleeding and pain with a documented or undocumented pregnancy. This interactive case-based curriculum involves an interdisciplinary approach with the use of clinical presentations, lab reviews, radiologic images, and patient counseling. A bit of background is that miscarriages or early pregnancy loss are common, and ectopic pregnancies are still associated with high risk of morbidity and mortality. This is an important topic that residents may encounter. Whether counseling patients regarding a threatened miscarriage or with acute abdominal pain and concern for an ectopic, these are skills that an incoming intern in most residency programs may find helpful. This session also discusses some of the related exam findings, laboratory values, and radiologic images that can be part of caring for this common medical condition that you may see in women. The design of this program is one of an interactive session. It can be adjusted to accommodate the number of students that are participating as well as the time that you have to commit. You will see again that that is based on cases such as this one in the middle of your screen. Here we have a 37-year-old G3P2002 at 5 weeks and 3 days by sheer regular LMP who presents with some spotting when she wipes and some worsening pain over the last couple days. In this situation, you may ask groups of students to come together to think of possible diagnoses. If you were doing this virtually, you could have them post their possible diagnoses in the chat. And this gives an opportunity for students to learn from one another as well as from a facilitator or facilitators. Then you could go on and show a image such as this pelvic ultrasound image of a start of a intrauterine pregnancy with a yolk sac and fetal pull and decide how that may change or not change some of the diagnoses that you have and why so. Then you can go through other considerations such as other locations for possible bleeding, risk factors for a miscarriage, RH factor, and how that's going to come into play for your care of these patients, and then what to do next. A big part of this session is on counseling, and so we spend quite a bit of time talking amongst ourselves about how to maybe counsel a patient for something such as this case, which was a threatened miscarriage. And that way students can learn some little nuances from not only faculty but from each other on things that may be helpful to learn to say to a patient in this situation or things they may not want to say as well. As you can see, this is an interactive type session. It is based on clinical vignettes. I do recommend using audio-visual aids because that helps in the learning process and makes it more interdisciplinary, relating radiology with more pathology to pharmacology, diagnoses, treatment plans, and so forth. Again, this is all based on a set of clinical vignettes. There is discussion not only on pain and bleeding in early pregnancy, but the use of the discriminatory zone with quantitative HCGs and what you should and shouldn't see depending on what that number is. And so that is more correlation. And then, of course, a lot of this is based on communication. We also do some where we will pose a question where I ask, you get a page regarding a patient blank. In this situation, what do you want to do next? To give them some experience further in answering a page on certain topics such as these first trimester bleeding and cramping. Outcome-wise, this session has been chosen and attended by students from many different specialties, from emergency medicine, general surgery, OB-GYN, family medicine. We've even had some pediatric future residents join these sessions, and they've come back with positive feedback. I've included on the screen some references that may be handy for you as well. These references can be used not only to help you prepare for such a session, but are good references to give to the students. It also can be used as part of pre-work in preparation so that they come into the session even more prepared and allow for more interaction and discussion. I hope this has been helpful and may help you either use this in your upcoming transition to residency course, or can use something like it for this or other topics that you find important for your students to be learning before they go into residency. Thank you very much for all you do for your students.